Hello, my name is Andrei Filippov and my topic is hyperkalemia after missed hemodialysis. Definition: hemodialysis is the most common method to treat advanced and permanent renal failure. Failure, we have learned a lot about how to make hemodialysis treatments more effective and how to minimize their side effects. Hemodialysis is the most common method to treat advanced and permanent renal failure. Since the 60s, when hemodialysis first became a practical treatment for kidney failure, we have learned a lot about how to make hemodialysis treatments more effective and how to minimize their side effects.
Welcome to the Elective Rotation Podcast, Critical Care Pharmacy Minute, where I discuss one critical care pharmacy thought in about 1 minute. I'm Pharmacy Joe of PharmacyJoe.com. Treatment of severe hyperkalemia should follow a 3-step process. In my experience, a pharmacist at the bedside can play a significant role in ensuring the steps are followed in the proper order. And the steps are, number 1, protect the cardiac membrane with IV calcium. Number 2, hide the potassium from the heart. Number 3, remove the excess potassium from the patient. IV calcium works within minutes to protect cardiac membranes from the deleterious effects of hyperkalemia. That's why it should be given first before any treatments to lower the potassium. Step 2 is to hide the potassium from the heart by moving it intracellularly. The intracellular concentrations of sodium and potassium are essentially the reverse of the plasma concentrations. This is why a couple extra MEq of potassium doesn't do any harm inside cells. The strategies for moving potassium inside the cells are IV insulin, followed by IV dextrose to prevent hypoglycemia, high-dose nebulized albuterol, and IV sodium bicarbonate. The effects of these treatments will not last more than a few hours as potassium re-equilibrates and leaves the cells back into the plasma. And that's why the third step is to remove the excess potassium from the patient. For severe hyperkalemia, the treatment of choice for this is hemodialysis. My Hospital Pharmacy Academy will help you take your clinical pharmacy skills to the next level. To learn more, go to pharmacyjoe.com/academy.
Applications in medicine. During hemodialysis, 2 needles are inserted in your arm through the access site and attached with tape in the place to hold them firm. Each needle is attached to a flexible plastic tube that connects to the dialyzer. Through a tube, the dialyzer filters your blood in a few ounces grams at a time. When all that extra weight and liquids pass from your blood to the veins will call desalinization. And the filtered blood returns to your body through the second tub. Patients with chronic hyperkalemia may have relatively normal ECGs even on high levels, and significant ECG changes may be present at much lower levels in patients with sudden spikes in serum potassium.
We have 1 critical minute to focus on the ECG changes in hyperkalemia. Let's go. The first changes that occur as potassium levels rise are the peaking of T waves. Next, the amplitude of the P wave decreases and the PQ interval increases. The QRS widens severely. As potassium increases further, the shape of the QRS segment and the T wave become more sine-like. This is highly associated with ventricular fibrillation and with that, cardiac arrest. If you have a patient with hyperkalemia that has a wide QRS segment, keep them on the monitor at all times. For more information on hyperkalemia, including treatment, watch my video on it. You are dismissed.
Pros and cons. Pros. Promising treatment will cure the disease. extends life of patients. Cons: expensive, difficult to acquire, not enough clinical trials.
Hi there, my name's John Mabey. Welcome to another segment of Hippo Shorts. In this segment, we're going to talk about specific treatments directed at patients that are symptomatic and have EKG changes due to hyperkalemia. There are 3 prongs to this approach. The first one is stabilizing the cardiac membranes. The second is trying to shift potassium back into cells. And lastly, we want to try to eliminate potassium from the body. How do we stabilize the cardiac membranes? That's done by administering 1 gram of calcium gluconate that's delivered IV. That's the same as giving 10 cc's of a 10% solution. How do we shift potassium into cells? The common way we do that is by administering 10 units of regular insulin that's given as an IV bolus, along with 50 cc's of D50 that's administered over a 5-minute period. Lastly, how do we eliminate potassium from the body? In patients with renal function, you can give that person furosemide as an IV dose of 40 milligrams. Alternatively, we can use patiromer that's given as an 8.4 milligram dose per day. Lastly, in patients that are refractive to treatment or if they have poor renal function, that person is probably a candidate for hemodialysis. So that wraps it up for Hippo Shorts for today. If you want more information, please feel free to go to hippoeducation.com. We'll see you next time.
Issue applied in Ecuador. In Ecuador, the problem lies in our peculiar health conditions. The necessary inputs are not available to prepare a solution, a standard polarizer, so it has to be adapted to the available inputs that have not been approved but with appropriate investigations. Hyperkalemia occurs frequently due to iatrogenic causes and is therefore a preventable alteration. It is the 3rd most frequent disturbance and has reported incidences of 1.4 to 1.7% in hospitalized patients.
Renal replacement therapy options. Hemodialysis is the process of cleaning the patient's blood outside the body. The blood is routed through a dialyzer to clean it and is then returned to the patient. The process is controlled by a hemodialysis machine which, amongst other things, pumps the blood and dialysis fluid around the circuit, adds in an anticoagulant, removes excess fluid, and regulates the entire cleaning process. The dialyzer comprises a large number of capillary-sized hollow fibers. To remove the toxins, a special dialysis fluid is added into the filter and bathes the fibers. The blood flows into the fibers. Metabolic toxins, urea, and other small particles pass through the membrane of the hollow fibers and are thus filtered out of the blood. By contrast, vital substances and blood cells are held back due to the small size of the pores. At the same time, excess fluid is removed from the patient's body. The transfer of metabolic toxins through the membrane into the dialysate is based in part on the principle of diffusion. So what form does the treatment take? Hemodialysis is usually carried out in a dialysis center. Patients first undergo an operation to implant a shunt between an artery and a vein in the lower arm, which provides access to their blood. Hemodialysis is usually performed 3 times a week and takes 3 to 6 hours. Modern hollow fiber dialyzers have greatly improved the efficiency of the treatment. Thanks to industrial production techniques, it is now possible to manufacture dialyzers that exhibit high cleaning performance in large numbers. State-of-the-art dialysis machines monitor patients to ensure critical conditions can be detected and treated at an early stage. Fresenius Medical Care, creating a future worth living.
Conclusion. It is important if you have some of the symptoms of this disease, you go talk with your doctor, and if you have hyperkalemia, start the treatment immediately, because it could involve the organs and take place in part of them. The kidneys do much more than eliminate waste and unnecessary fluid. They also produce hormones and balance the body's chemicals. When the kidneys stop working, you may have anemia problems and conditions that affect the bones, nerves, and skin.
Artificial kidney. Hemodialysis. Kidneys are one of the vital organs for the survival. Filtration of urine artificially, other than by kidney, is called hemodialysis. In abnormal or ill health conditions like infections, injury, or restricted blood flow to kidneys will reduce the functions of kidney. This leads to accumulation of poisonous or toxic wastes in the body, sometimes which can even lead to death. In case of kidney failure, an artificial kidney can be used. An artificial kidney is a device which is used to remove nitrogenous waste products from the blood through the process called dialysis. 1. Artificial kidneys contain a number of tubes with a semi-permeable lining suspended in a tank filled with dialysing fluid. 2. This fluid has the same osmotic pressure as blood, except that it is lack of nitrogenous wastes. 3. One line connected to the artery is connected to the one end of dialysis device, where the blood is collected from patient for filtration. 4. During this passage, the waste products from the blood pass into dialysing fluid by diffusion. 5. The purified blood is pumped back into the vein of the patient, which is connected to other end of the dialysis device. This is similar to the function of the kidney, but it is different since there is no reabsorption involved. Normally, in a healthy adult, the intake filtrate in the kidneys is about 180 liters a daily. However, the volume actually excreted is only a liter or 2 a day, because the remaining filtrate is reabsorbed in the kidney tubules.